Lib Dem parliamentary candidate with us this morning, Zöe Franklin. Of course, you have done some of this research looking at these numbers coming from the House of Commons library. Tell us what you found.
Yeah, so we did some analysis of data available with the House of Commons library and identified that actually in Surrey Heartlands, which is the NHS trust that looks after places across Surrey, including Guildford constituency, they have had a £9 million cut in spending on GP services since 2019. That's a huge amount of money at a time when, as Simon has said, we are seeing more and more patients. We've had significant population growth in the area, and GPs are constantly working really hard along with their colleagues in their practices to serve their patients. But to do that in a climate where the amount of money coming to them is being cut, it's just not fair on patients or on GPs and their staff.
What money would you want to see here then?
So we are looking over the next 4 years. We want to recruit 8,000 new GPs. That includes training, recruiting, encouraging people to stay in the profession. That would create 65 million new appointments, and that we based on the government's own figures, we reckon that will cost 4 billion over the 4-year period. And that is really important. We need to be investing in preventative healthcare, and that is what GP appointments are. You come, you sit down with your GP, you talk through the issues you're experiencing, and you get that support and care, which can prevent long-term problems.
You're talking about bringing more GPs in, but there's a shortage of GPs. How can we get them into the profession?
Well, so there's a couple of things. There's one is about encouraging current GPs to stay. I speak to GPs and they talk about how challenging it is. They want to be there serving and looking after their patients, but the bureaucracy, the challenges are so huge that some of them are choosing to take early retirement. We want to turn that round. We also want to create more training places. And it's so important that we get young people in training to become GPs. We want to encourage junior doctors to consider being a GP as a career path for them. And that would start to change the direction. It's not a quick fix, but it's a really important long-term goal that we need to work on.
We just heard from Simon about actually the appointments here have doubled, maybe even trebled in terms of the duration that patients see their doctors for. Of course, that makes things tricky. Do you think that that's the right way to go about things?
So it's really good that Simon and the team here have looked at what their patient needs and have responded to that need. That is absolutely crucial. People need to have the space to explain their situation to the GP without feeling overly rushed, because that means they get to share all the information they need to and can get the right healthcare. So I'm not about trying to put a marker on exactly what time frame each GP practice should be using. They need to look at their patients and their need. The crucial thing is funding, the funding that's needed for GPs, more GPs and more appointments so that we can get people in for those preventative GP appointments.
Where's the money coming from?
So that's going to be a question for after the general election. We hope that we will be getting all the figures that enable us to do that. But when our manifesto comes out, we always make sure it's fully costed.
OK, Simon, you've just heard what Zoe's got to say there. Does it sound like it makes sense? It's going to help you?
Very definitely. College GPs, there's widespread consensus, I think, in among professional circles that we need.